actually, I think there are not many surprises here. I think throughout the pandemic, we have heard over and over again the limitations to which the WHO guidance has been actually followed by other countries. And really, in their technical advisory role, there's limitations towards what type of impact they can make. I think the average person may not be aware that the entire WHO budget is less than half of that of an average US mid-sized hospital, half, with the task to save the world from a unknown novel pathogen. Simply unrealistic. So I think that one of the central elements of this report that has come through is the fact that there's an important need for reform at a very urgent level. I think it's also been quite balanced. I think it highlighted where the WHO also did need to act more urgently, and particularly around that first declaration in January, where it announced a public health emergency of international concern. The independent panel showed that that was a week too late. And also, due to the slow action of other countries, the characterization as a pandemic did not come until March. So certainly from a political leadership perspective, more teeth could have been applied, even through rhetoric, if not through muscling through policies directly.
They were also very critical of individual countries and the way they have responded, literally ignoring some of the very strong health warnings and advice that has been given from the WHO, admittedly playing catch up. Unfortunately, when we look at a lot of countries, that persists. So how does this start to be rectified if countries are still defying what is their advice?
Beverly, you've got it. Here we see that this report is on lessons learned, and it's almost puts it in past tense. We're very much still repeating those early mistakes from 1 year on, and many countries still not taking the tools that we know to work around distancing, etc., to ensure that they have a successful response regionally, locally, nationally. Because it's been so disjointed, we're in a situation where every country has done its own thing, and to varying success. So Australia, for instance, has had a very successful response to this, whereas other countries delayed and not only had much longer lockdowns, but their economy suffered much more as well. So we do now have the evidence to show that speed is the name of the game. The wait and see approach makes a lot of sense in some ways when it's not an outbreak. It feels like common sense to take your time, evaluate the evidence, but getting comfortable with acting on imperfect data, I think, has been the biggest weakness of many governments because of their fear of how the electorate, the population will respond, and their term in government. So I'd say that political leadership, global leadership here has been another fundamental flaw that is, I'm not so confident we're going to recover from based on the current trajectory and what we're seeing in different countries.
Yeah. One of the things they also highlight is the global vaccine inequity, and they have recommended that there is, several million, nearly 1 billion vaccines to be provided to countries that can't afford it. But again, we're seeing no sign, there's no sign that countries are going to accede to that, and also for those patents to be forgiven so that more broad production can take place.
Yes, globally, we see the trajectory is heading in the wrong direction. Cases are rising and at an incredibly rapid rate. We have a lot to learn about the B1617 variant, the Indian variant, which is also now present here, detected in London, is already overtaking the Kent variant as the nominal form, even though we're now in the UK in a much better position due to highly successful vaccine rollout. But we should definitely be keeping more of an eye on, not only do we now know that it's more transmissible, but it hasn't been determined yet to what degree it can evade vaccines. So even in countries with high vaccine rollout, if we continue to see what is occurring in India, elsewhere, not only is it B1617.2 version 2 or others, we're looking at a position where this cycle of vaccine hoarding, the booster doses, those that have been promised to low and middle income countries will be diverted, will be given to deal with variants and towards immunizing younger populations, including teenagers, once we learn about the real impact of long COVID. It's only been a short time. We don't understand the long-term effects. So even though this trickle-down donation model that is currently being suggested isn't working, because we still see that even though the US surprised the rest of the world and certainly surprised the pharma lobby by saying, yes, we will support an IP waiver within that TRIPS agreement that would allow more manufacturers to make the vaccines that we need to vaccinate the world. There is a definite actual interesting to see Gates do a big U-turn on that and come out and say, after a very direct no about there not being enough factories, we see people in Canada saying that they have the quality standards, they have the personnel, they have the sites. Give us the blueprint, let us make the vaccine. And the trade obstacles are in the way currently. So that's one step forward, but all members of the WTO, 164, have to agree by a consensus that to say, yes, we can lift that IP waiver. And that will take months. It's not going to help with the urgent, immediate situation. And my concern is that we have to ensure that we are to high quality, and with that technology transfer, sharing vaccine know-how, getting the personnel on the ground, doing this as fast as possible. The trickle-down donation model will only lead to more variants, and I don't believe politicians when they say that it's going to go to where it needs to, because it hasn't happened yet, and we're anticipating booster doses and getting those younger people protected. Mayor of Manchester, Andy Burnham, also called for that. It's under 16s to get vaccinated here in the UK. But we need to be looking at the rest of the world. It's a global problem, and people can't be isolated forever in this.
Yeah, indeed. Oksana, appreciate, as always, your analysis. Thanks so much.
Thank you.